Hi, my name is Michelle Miller and I'm the Human Services Administrator for Martin County, and we're here today in recognition of Mental Health Awareness Month and the hope to raise awareness about the issues surrounding mental health in Martin County. And today I'm joined by Sheriff William Snyder of the Martin County Sheriff's Office. Welcome. Thank you for joining me today. So Tuesday you gave a really impactful and sobering presentation to the county commissioners about the state of mental health in our community, and I want us to take a little bit of time today to dig a little bit deeper into some of the topics that you discussed.
Sure.
So let's start off with just talking about some trends that you've seen over the years in your tenure as it's relating to mental health.
Sure, Michelle. Let me start off by saying that my career started in early 1973. So I've had a bird's eye view through the front windshield of a police car really for decades. And anecdotally, what I've seen personally is that the incidences of mental illness crisis and the attendant police actions, which would be Baker Act, sometimes uses of force, have gone up noticeably. Probably in the last 2 years, I think that trend line up has gone even maybe a 90 degrees straight up. So if the question is what's the trend, my answer is a much higher volume of calls for services for people in crisis because of mental illness.
Mm-hmm. And you talked Tuesday about the number of calls that your agency sees probably per day or so, and you recently also indicated that there may be as many as 4 or so Baker Act calls per day. Do you think that this is the best approach to our services, or what do you see us doing about this trend?
Well, I think that the Baker Act itself is absolutely the action of last resort. I don't think that that's a good way to try to solve the problem. The Baker Act, for your audience, if they don't know, is a state law that empowers law enforcement to take someone into custody for psychiatric evaluation up to 72 hours if that person presents a danger to themselves or others. So what that means is the crisis has gotten so bad in that person's life that someone's picked up the phone and called law enforcement. Well, when we go, and that's what's going on, our resources are pretty limited, and the Baker Act oftentimes is not just the best choice, it's the only choice to stabilize the situation and get that person some help.
Mm-hmm. And at that time when those calls are made, are there any types of interventions that happen between the deputy and the person, or how are they evaluated?
Well, all of our deputies now, almost all of them, have gone through CIT, crisis intervention training. And so we're trained to look for certain behavior, certain actions on the part of the person who's having the crisis. If it meets the threshold, if that person is threatening harm to themselves, threatening harm to others, is an obvious need of care, maybe medical care oftentimes, but refuses to participate in their own assistance, then we have to use that Baker Act form or the Baker Act law and take that person for evaluation.
Mm-hmm. And what would you recommend a resident do if they are experiencing a crisis with their family? Is there an alternative that you think may be better than, maybe that last resort of calling 911?
Yeah, I think that's a great question. Here's the broad answer is this: if a person is having a mental illness crisis that's so profound that the family has to pick up the phone and called law enforcement, and a deputy or a city steward officer goes to the scene, then I would say that the person making that phone call, the family, should ask themselves, have we done everything we could do to not let it get to this stage? Have you taken that loved one for evaluation? Have you, if they've been evaluated, are they on medication? Are they taking their medication? Are you using good family dynamics and good family intervention? Have you, if you're a church-going person, have you involved your pastor or your rabbi? I mean, there's a lot of resources out here. There's no magic answer, but I will tell you that calling law enforcement should be the absolute final act and almost one of desperation, because what you're saying at that point is, look, nothing I've done has worked. My loved one is a threat to himself, herself, or others. Please come and help.
Mm-hmm. And recently, in the past few years, your agency has developed a behavioral health unit that has really helped to assist with some of these types of calls. And I think it really came at a great time right at the beginning of COVID. And as we've seen, because of COVID, people's mental health there's been studies that have shown that people's mental health have really been affected because of COVID. So what can we know about your behavioral health unit and what it does for our community?
Well, we're still in a stage of building. We have started. We have 3 full-time civilian contractors from a mental health provider here on the Treasure Coast. We have a full-time sheriff's employee, and we have nurses in our jail 24/7 evaluating inmates coming in. One of the big pieces for us that we really found was lacking is that some of the people, when they get to this crisis stage, don't have good case management. So what does that mean is that we go to the house, we Baker Act a person, they're threatening to kill themselves or their loved one. We go ahead, we Baker Act them, then we find out they're released within 72 hours, oftentimes much less than 72 hours, and we get called back, and we get called back. So what prompted me was probably one of the big triggers that moved us towards having a health unit was the fact that we wanted to curb that recidivism rate. The other one was we're seeing all over the country law enforcement having very bad outcomes when they're called, such as using deadly force. Now, I have in the last 6 months or so, it can be a little off, I have 6 deputies that were involved in shooting incidents with people having a mental health crisis. And that's the worst outcome possible, the absolute worst outcome possible. So that's why we have the mental health unit. We're hoping to reduce the recidivism, and we're hoping to actually get to a point where our civilian staff can come out with our deputies and at the safe time kind of take a look and bring more of an education background and a psychological background, sociologist background to the situation.
Yeah, you talked a little bit about that Tuesday. So maybe in the future, these calls may look a little different. Maybe the person that responds to the scene looks a little different than a deputy in their uniform, and as you alluded to, the tools that they have that they know what to use. And like you said, we're seeing that in other communities around the state and the country with some promising research. So is that something you'd like to see us working towards here in Martin County?
Well, we are working towards that, Michelle. What I think, and I've gotten this, and I think all people in my industry get it, we know that when the road deputy or the uniformed police officer gets there, they have a certain amount of equipment with them, and that's all they have, a gun, and a taser, maybe a nightstick, pepper spray. Those are not good. Those are tools of last resort. And someone having a mental health crisis, that's not helpful. And we don't want people to decompensate and get worse because of our being there. So we're visualizing now and working towards having a separate unit of sworn deputies, law enforcement, people who may be dressed differently, maybe have a sports coat covering their gun. And so where maybe the uniform in the past with an exposed gun could be a trigger, we'll eliminate that possibility. And maybe if that deputy, as I see it, along with a civilian professional, maybe that's a better way to respond when someone's having a crisis.
And what would you say to the community at large about some ways that we could all work together to really stem these problems that we're seeing?
Well, that's a huge question. It's a great question. I think there's some broad answers, though. I don't think the situation is hopeless, but it's not going to be easy to fix. One of the things that people can do is family units have to work together. And I know there's a stigma to mental illness. I know that. But I don't know that there's many families in Martin County that don't have a loved one, a niece, a nephew, a husband, a wife, a child, who isn't struggling. And so the sooner the family realizes something's going on, the sooner they get help, the more likely it is that you won't see that road deputy, that uniformed patrol person walking up to your driveway to help you subdue a loved one who's gotten out of control. I played that tape at the commission meeting. It was a very cleaned up version. The full version is the family calls for law enforcement, the cops get there, they do their best, they're really kind, they sound great. They can't get this diffused, and finally a young man, it looked like he was in his 20s, you saw the tape, goes after those police officers with a knife, and he's shot. We don't want that. We've had 5 of my deputies now, I told you, have experience having to shoot somebody with a mental health crisis. That's not acceptable.
So in Martin County, I do think that we are trying all to work together to really do what we can to serve the needs of the community. And you mentioned stigma, and I think that's one thing that we really need to work more on, is reducing that stigma of mental health. Because like you said, we all know somebody who's dealing with it. And do you have any other suggestions of ways that we could do that as far as in the community and working together?
I think I'm going to just have to be redundant. The biggest thing is the family unit. I think teachers understand it. Teachers know when a child is out of control, but that's not a family member. We understand it when we see somebody out in public who's having a crisis. But it's in the quietness, it's in the sanctity of the home, where people out of love and care start the process of getting some help. But society in general, I think we'll have to be willing to say, look, there could be a big cost to getting this right. Probably what we desperately need throughout the country, certainly here on the Treasure Coast, is long-term treatment, affordable, or for people who have no insurance. Well, that's big money, that's real money. But right now, there's very, very few places for the underinsured to go for meaningful long-term care.
Right, I agree. That's definitely something that we need to see long term. And in the short term, I do see that in Martin County, there's many different providers. 211 is a great resource for people if they are looking for, where do they call immediately if they're having a crisis. New Horizons has a mobile response unit that can send somebody out with a licensed professional. So I do think that us all working together is making some difference, and we do need to continue to do so in the long term. I thank you for being with me today.
My pleasure.
Do you have any closing remarks that you would like to say about it?
Well, yes, I do. I'll close with this. We get it in our industry that we have to make changes, and I want my fellow citizen in Martin County to get it also, that we have to work together. We have to be supportive of each other, and we have to all put our shoulders to the plow and be our brother's keeper, like I said, and try to help one another through what we're seeing.
Thank you for joining me, Sheriff.
My pleasure.